Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Doxorubicin Trabectedin, with Trabectedin maintenance in Leiomyosarcoma. Background. The addition of Trabectedin to Doxorubicin, followed by Trabectedin maintenance, may have superior efficacy to Doxorubicin alone, as first-line treatment in patients with advanced leiomyosarcoma. Methods. We conducted a Phase 3 trial involving patients with metastatic or unresectable leiomyosarcoma who had not received chemotherapy previously. Patients were randomly assigned to receive either single-agent doxorubicin, 6 cycles, or doxorubicin plus trabectedin, 6 cycles, with continued trabectedin as maintenance therapy in patients in the doxorubicin trabectedin group who did not have disease progression. Surgery to resect residual disease was allowed in each group after 6 cycles of therapy. Analyses of progression-free survival, primary endpoint, and overall survival, secondary endpoint, were adjusted for 2 stratification factors: tumor origin site, uterine versus soft tissue, and disease stage, locally advanced versus metastatic. The primary endpoint results were reported previously. Results. A total of 150 patients underwent randomization. At a median follow-up of 55 months, interquartile range, 49 to 63. A total of 107 patients had died, 47 in the doxorubicin trabectedin group, and 60 in the doxorubicin group. The median overall survival was longer in the doxorubicin trabectedin group, 33 months, 95% confidence interval, CI, 26 to 48, than in the doxorubicin group, 24 months, 95% CI, 19 to 31. The adjusted hazard ratio for death was 0.65, 95% CI, 0.44 to 0.95. In a finding consistent with earlier reports, progression-free survival was longer in the doxorubicin trabectedin group, 12 months, 95% CI, 10 to 16, than in the doxorubicin group, 6 months, 95% CI, 4 to 7. The adjusted hazard ratio for progression or death was 0.37, 95% CI, 0.26 to 0.53. The incidence of adverse events and the percentage of patients with dose reductions were higher with doxorubicin plus trabectedin than with doxorubicin alone. Conclusions. Combination therapy with doxorubicin and trabectedin induction, followed by trabectedin maintenance, was associated with improved overall survival and progression-free survival, as compared with doxorubicin alone, among patients with metastatic or surgically unresectable uterine or soft tissue leiomyosarcoma. A monoclonal antibody to PACAP for migraine prevention. Background. Targeting pituitary adenylate cyclase activating polypeptide, PACAP, is a new avenue for treating migraine. The efficacy and safety of intravenous LU-AG0922, a humanized monoclonal antibody directed against the PACAP ligand, for migraine prevention are unclear. Methods. In a Phase 2, double-blind, randomized, placebo-controlled trial, we enrolled adult participants, 18 to 65 years of age, with migraine for whom 2 to 4 previous preventive treatments had failed to provide a benefit. The trial included a 4-week treatment period and an 8-week follow-up period. Participants were randomly assigned in a 2:1:2 ratio to receive a single dose, baseline infusion of 750 mg of LU-AG0922, 100 mg of LU-AG0922, or placebo. The primary endpoint was the mean change from baseline in the number of migraine days per month during weeks 1 through 4 in the LU-AG0922 750 mg group as compared with the placebo group. Results. Of 237 participants enrolled, 97 received 750 mg of Lu-Ag, 09222, 46 received 100 mg of Lu-Ag, 09222, and 94 received placebo. The mean number of baseline migraine days per month was 16.7 in the overall population, and the mean change from baseline over weeks 1 through 4 was -6.2 days in the Lu-Ag, 09222 750 mg group, as compared with -4.2 days in the placebo group. Difference, -2.0 days, 95% confidence interval, -3.8 to -0.3, p equals 0.02. Adverse events with a higher incidence in the Lu-Ag, 09222 750 mg group than in the placebo group during the 12-week observation period included coronavirus disease 2019, 7% versus 3%, nasopharyngitis, 7% versus 4%, and fatigue, 5% versus 1%. Conclusions. In a phase 2 trial, single intravenous infusion of 750 mg of Lu-Ag, 09222, showed superiority over placebo in reducing migraine frequency over the subsequent 4 weeks. Adjunctive intravenous Argatroban or Eptifibatide for ischemic stroke. Background. Intravenous thrombolysis is a standard treatment of acute ischemic stroke. The efficacy and safety of combining intravenous thrombolysis with Argatroban, an anticoagulant agent, or Eptifibatide, an antiplatelet agent, are unclear. Methods. We conducted a phase 3, 3-group, adaptive, single-blind, randomized, controlled clinical trial at 57 sites in the United States. Patients with acute ischemic stroke who had received intravenous thrombolysis within 3 hours after symptom onset were assigned to receive intravenous Argatroban, Eptifibatide, or placebo within 75 minutes after the initiation of thrombolysis. The primary efficacy outcome, the utility-weighted 90-day, modified Rankin scale score, range, 0 to 10, with higher scores reflecting better outcomes, was assessed by means of centralized adjudication. The primary safety outcome was symptomatic intracranial hemorrhage within 36 hours after randomization. Results. A total of 514 patients were assigned to receive Argatroban, 59 patients, Eptifibatide, 227 patients, or placebo, 228 patients. All the patients received intravenous thrombolysis, 70% received alteplase, and 30% received tenecteplase, and 225 patients, 44%, underwent endovascular thrombectomy. At 90 days, the mean, plus or minus, utility-weighted, modified Rankin scale scores were 5.2 plus or minus 3.7 with Argatroban, 6.3 plus or minus 3.2 with Eptifibatide, and 6.8 plus or minus 3.0 with placebo. The posterior probability that Argatroban was better than placebo was 0.002. Posterior mean difference in utility-weighted modified Rankin scale score, minus 1.51, plus or minus 0.51, and that Eptifibatide was better than placebo, was 0.041. Posterior mean difference, minus 0.50, plus or minus 0.29. The incidence of symptomatic intracranial hemorrhage was similar in the 3 groups, 4% with Argatroban, 3% with Eptifibatide, and 2% with placebo. Mortality at 90 days was higher in the Argatroban group, 24%, and the Eptifibatide group, 12%, than in the placebo group, 8%. Conclusions. In patients with acute ischemic stroke, treated with intravenous thrombolysis, within 3 hours after symptom onset, adjunctive treatment with intravenous Argatroban or Eptifibatide did not reduce post-stroke disability and was associated with increased mortality. A new Orthonairovirus associated with human febrile illness. Background. In June 2019, a patient presented with persistent fever and multiple organ dysfunction after a tick bite at a wetland park in Inner Mongolia. Next-generation sequencing in this patient revealed an infection with a previously unknown Orthonairovirus, which we designated wetland virus, WELV. Methods. We conducted active hospital-based surveillance to determine the prevalence of WELV infection among febrile patients with a history of tick bites. Epidemiologic investigation was performed. The virus was isolated, and its infectivity and pathogenicity were investigated in animal models. Results. WELV is a member of the Orthonairovirus genus in the Nairoviridae family and is most closely related to the tick-borne Hasara Orthonairovirus genogroup. Acute WELV infection was identified in 17 patients from Inner Mongolia, Heilongjiang, Jilin, and Liaoning, China, by means of reverse transcriptase polymerase chain reaction assay. These patients presented with nonspecific symptoms, including fever, dizziness, headache, malaise, myalgia, arthritis, and back pain, and less frequently with petechiae and localized lymphadenopathy. One patient had neurologic symptoms. Common laboratory findings were leukopenia, thrombocytopenia, and elevated D-dimer and lactate dehydrogenase levels. Serologic assessment of convalescent stage samples obtained from 8 patients showed WELV-specific antibody titers that were 4 times as high as those in acute phase samples. WELV RNA was detected in 5 tick species and in sheep, horses, pigs, and transbicalzokers, Myospelix ciliaris, sampled in northeastern China. The virus that was isolated from the index patient and ticks showed cytopathic effects in human umbilical vein endothelial cells. Intraperitoneal injection of the virus resulted in lethal infections in bulb/C, C57BL/6, and Kuhn-Young mice. The Hemophysalis cancina tick is a possible vector that can transovarially transmit WELV. Conclusions. A newly discovered Orthonairovirus was identified and shown to be associated with human febrile illnesses in northeastern China. Next, we will be discussing articles from Journal of American Medical Association. Balloon angioplasty versus medical management for intracranial artery stenosis. The basis randomized clinical trial. Question: is balloon angioplasty plus aggressive medical management superior to aggressive medical management alone for the treatment of severe symptomatic intracranial atherosclerotic stenosis, (SICAS)? Finding, in this randomized clinical trial that included 501 patients, the composite outcome of any stroke or death within 30 days, or an ischemic stroke, or revascularization of the qualifying artery after 30 days through 12 months, occurred in 4.4% of patients in the balloon angioplasty group and 13.5% of patients in the aggressive medical management group, a statistically significant difference. Meaning, the findings suggest that balloon angioplasty plus aggressive medical management may be an effective treatment for SICAs, although the risk of stroke or death within 30 days of balloon angioplasty should be considered in clinical practice. Next, we will be discussing articles from Annals of Internal Medicine. Association between false positive results and return to screening mammography in the Breast Cancer Surveillance Consortium cohort. Background. False positive results on screening mammography may affect women's willingness to return for future screening. Objective: to evaluate the association between screening mammography results and the probability of subsequent screening. Results. Women were more likely to return after a true negative result, 76.9%, 95% CI, 75.1% to 78.6%, than after a false positive recall for additional imaging only. Adjusted absolute difference, minus 1.9 percentage points, CI, minus 3.1 to minus 0.7 percentage points, short interval follow-up, minus 15.9 percentage points, CI, minus 19.7 to minus 12.0 percentage points, or biopsy, minus 10.0 percentage points, CI, minus 14.2 to minus 5.9 percentage points. Asian and Hispanic/Latinx women had the largest decreases in the probability of returning after a false positive, with a recommendation for short interval follow-up, minus 20 to minus 25 percentage points, or biopsy, minus 13 to minus 14 percentage points, versus a true negative. Among women with 2 screening mammograms within 5 years, a false positive result on the second was associated with a decreased probability of returning for a third, regardless of the first screening result. Conclusion: women were less likely to return to screening after false positive mammography results, especially with recommendations for short-interval follow-up or biopsy, raising concerns about continued participation in routine screening among these women at increased breast cancer risk. Next, we will be discussing articles from British Medical Journal. Risk of dementia after initiation of sodium glucose cotransporter, 2 inhibitors versus dipeptidyl peptidase, 4 inhibitors in adults aged 40 to 69 years with type 2 diabetes. Objective: to compare the risk of dementia associated with sodium glucose cotransporter 2, SGLT2, inhibitors versus dipeptidyl peptidase 4, DPP4, inhibitors in adults aged 40 to 69 years with type 2 diabetes. Results: 110,885 propensity score matched. Pairs of initiators of an SGLT2 inhibitor or a DPP4 inhibitor were followed up for a mean 670, standard deviation 650 days, generating 1,172 people with newly diagnosed dementia. Incidence rate 0.22 per 100 per person years in initiators of SGLT2 inhibitors, and 0.35 per 100 person years in initiators of DPP4 inhibitors, with hazard ratios of 0.65, 95% CI 0.58 to 0.73, for dementia, 0.54, 0.46 to 0.63, for dementia requiring drugs, 0.61, 0.53 to 0.69, for Alzheimer's disease, and 0.48, 0.33 to 0.70, for vascular dementia. The hazard ratios for the control outcomes were 2.67, 2.57 to 2.77, for genital infections, 0.97, 0.95 to 0.98, for osteoarthritis-related encounters, and 0.92, 0.89 to 0.96, for cataract surgery. When calibrated for residual confounding measured by cataract surgery, the hazard ratio for dementia was 0.70, 0.62 to 0.80. The association was greater for more than 2 years of treatment, hazard ratio of dementia 0.57, 95% CI 0.46 to 0.70, than for 2 years or less, 0.52, 0.41 to 0.66, and persisted across subgroups. Conclusion: SGLT2 inhibitors might prevent dementia, providing greater benefits with longer treatment. As this study was observational and therefore prone to residual confounding and informative censoring, the effect size could have been overestimated. Randomized controlled trials are needed to confirm these findings. Next, we will be discussing articles from Lancet. General and Abdominal. Adiposity and Hypertension in 8 World Regions, a pooled analysis of 837 population-based studies with 7.5 million participants. Background. Adiposity can be measured using BMI, which is based on weight and height, as well as indices of abdominal adiposity. We examined the association between BMI and waist-to-height ratio, WHTR, within and across populations of different world regions, and quantified how well these 2 metrics discriminate between people with and without hypertension. Endings. The correlation between BMI and WHTR ranged from 0.76 to 0.89 within different regions. After adjusting for age and BMI, mean WHTR was highest in South Asia for both sexes, followed by Latin America and the Caribbean, and the region of Central Asia, Middle East and North Africa. Mean WHTR was lowest in Central and Eastern Europe for both sexes, in the high-income Western region for women, and in Oceania for men. Conversely, to achieve an equivalent WHTR, the BMI of the population of South Asia would need to be, on average, 2.79 kg/m2, 95% CI2 middle.31 to 3 middle.28, lower for women, and 1 middle.28 kg/m2, 1 middle.02 to 1 middle.54, lower for men than in the high-income Western region. In every region, hypertension prevalence increased with both BMI and WHTR. Models with either of these two adiposity metrics had virtually identical C statistics and NRIs for every region and sex, with C statistics ranging from 0 middle.72 to 0 middle.81 and NRIs ranging from 0 middle.34 to 0 middle.57 in different region and sex combinations. When both BMI and WHTR were used, performance improved only slightly compared with using either adiposity measure alone. Interpretation: BMI can distinguish young and middle-aged adults with higher versus lower amounts of abdominal adiposity with moderate to high accuracy, and both BMI and WHTR distinguish people with or without hypertension. However, at the same BMI level, people in South Asia, Latin America and the Caribbean, and the region of Central Asia, Middle East and North Africa, have higher WHTR than in the other regions. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Cancer Journal for clinicians. Proportion and number of cancer cases and deaths attributable to potentially modifiable risk factors in the United States, 2019. In 2018, the authors reported estimates of the number and proportion of cancers attributable to potentially modifiable risk factors in 2014 in the United States. These data are useful for advocating for and informing cancer prevention and control. Herein, based on up-to-date relative risk and cancer occurrence data, the authors estimated the proportion and number of invasive cancer cases, excluding non-melanoma skin cancers, and deaths, overall, and for 30 cancer types among adults who were aged 30 years and older in 2019 in the United States, that were attributable to potentially modifiable risk factors. These included cigarette smoking, secondhand smoke, excess body weight, alcohol consumption, consumption of red and processed meat, low consumption of fruits and vegetables, dietary fiber, and dietary calcium, physical inactivity, ultraviolet radiation, and 7 carcinogenic infections. Numbers of cancer cases and deaths were obtained from data sources with complete national coverage, risk factor prevalence estimates from nationally representative surveys, and associated relative risks of cancer from published large-scale pooled or meta-analyses. In 2019, an estimated 40.0%, 713,340 of 1,781,649 of all incident cancers, excluding non-melanoma skin cancers, and 44.0%, 262,120 of 595,737 of all cancer deaths in adults aged 30 years and older in the United States were attributable to the evaluated risk factors. Cigarette smoking was the leading risk factor contributing to cancer cases and deaths overall, 19.3% and 28.5%, respectively, followed by excess body weight, 7.6% and 7.3%, respectively, and alcohol consumption, 5.4% and 4.1%, respectively. For 19 of 30 evaluated cancer types, more than one-half of the cancer cases and deaths were attributable to the potentially modifiable risk factors considered in this study. Lung cancer had the highest number of cancer cases, 201,660, and deaths, 122,740, attributable to evaluated risk factors, followed by female breast cancer, 83,840 cases, skin melanoma, 82,710, and colorectal cancer, 78,440, for attributable cases, and by colorectal con, 25,800 deaths, liver, 14,720, and esophageal, 13,600, cancer for attributable deaths. Large numbers of cancer cases and deaths in the United States are attributable to potentially modifiable risk factors, underscoring the potential to substantially reduce the cancer burden through broad and equitable implementation of preventive initiatives. Here are the articles from Journal of Hepatology. Genetic risk accentuates dietary effects on hepatic steatosis, inflammation and fibrosis in a population-based cohort. Poor diet quality and specific genetic alleles are associated with steatotic liver disease. Diet has a much greater impact on hepatic steatosis in those at higher genetic risk. These effects were seen for both liver fat content and iron-controlled T1 time, a measure of fibrosis and inflammation. Hence, dietary interventions may have a greater impact in populations at higher genetic risk. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Association of GLP-1 receptor agonists and hepatocellular carcinoma incidence and hepatic decompensation in patients with type 2 diabetes. Background and aims. Hepatocellular carcinoma, HCC, is a leading cause of cancer death. HCC is preventable with about 70% of HCC attributable to modifiable risk factors. Glucagon-like peptide 1 receptor agonists, GLP-1 RAS, Food and Drug Administration approved medications for treating type 2 diabetes mellitus, T2DM, have pleiotropic effects on counteracting risk factors for HCC. Here we evaluate the association of GLP-1 RAS with incident HCC risk in a real-world population. Results. GLP-1 RAS were associated with a lower risk of incident HCC, with hazard ratio of 0.20, 0.14 to 0.31, 0.39, 0.21 to 0.69, 0.63, 0.26 to 1.50, compared with insulin, sulfonylureas, and metformin respectively. GLP-1 RAS were associated with a significantly lower risk of hepatic decompensation compared with 6 other anti-diabetes medications. Reduced risks were observed in patients without and with different stages of fatty liver diseases, with more profound effects in patients without liver diseases. Similar findings were observed in patients with and without obesity and alcohol or tobacco use disorders. GLP-1 RA combination therapies were associated with decreased risk for HCC and hepatic decompensations compared with monotherapies. Conclusions. GLP-1 RAS were associated with a reduced risk of incident HCC and hepatic decompensation compared with other anti-diabetes medications in patients with T2DM. These findings provide supporting evidence for future studies to investigate the underlying mechanisms and their clinical use. Here are the articles from Clinical Gastroenterology. In patient outcomes, gastric antral vascular ectasia, in those with aortic stenosis, a retrospective study of 85,000 hospitalizations. Goals. To investigate the outcomes of hospitalized patients with gastric antral vascular ectasia, GAVE, in the setting of aortic stenosis, AS. Background. Although AS is associated with gastrointestinal arteriovenous malformations, its association with GAVE, a rare cause of upper gastrointestinal bleeding, remains unknown. Conclusions. Patients with AS have a twofold increase in the risk of development of GAVE. Patients with AS admitted for GAVE-related bleeding are at higher rates of hypovolemic shock, acute coronary syndrome, and higher resource utilization when compared with admitted patients with GAVE without AS. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Development of predictive models to inform a novel risk categorization framework for antibiotic resistance in Escherichia coli caused uncomplicated urinary tract infection. Background. In clinical practice, challenges in identifying patients with uncomplicated urinary tract infections, UUTIS, at risk of antibiotic nonsusceptibility, may lead to inappropriate prescribing and contribute to antibiotic resistance. We developed predictive models to quantify risk of nonsusceptibility to 4 commonly prescribed antibiotic classes for UUTI. Identify predictors of nonsusceptibility to each class. and construct a corresponding risk categorization framework for nonsusceptibility. Conclusions. Our predictive models highlight factors that increase risk of nonsusceptibility to antibiotics for U-Utis, while the risk categorization framework contextualizes risk of nonsusceptibility to these treatments. Our findings provide valuable insight to clinicians treating U-Utis and may help inform empiric prescribing in this population. The ethical obligation to treat infectious patients, a systematic review of reasons. During pandemics, healthcare providers struggle with balancing obligations to self, family, and patients. While HIV/AIDS seem to settle this issue, coronavirus disease 2019, COVID-19, rekindled debates regarding treatment refusal. We searched Medline, Embase, Sinal Complete, and Web of Science, using terms including obligation, refusal, HIV/AIDS, COVID-19, and pandemics. After duplicate removal and dual, independent screening, we analyzed 156 articles for quality, ethical position, reasons, and concepts. Diseases in our sample included HIV/AIDS, 72.2%, severe acute respiratory syndrome, SARS 10.2%, COVID-19, 10.2%, Ebola, 7.0%, and influenza, 7.0%. Most articles, 81.9%, N equals 128, indicated an obligation to treat. COVID-19 had the highest number of papers indicating ethical acceptability of refusal, 60%, p less than 0.001, while HIV had the least, 13.3%, p equals 0.026. Several reason domains were significantly different during COVID-19, including unreasonable risks to self/family, 26.7%, p less than 0.001, and labor rights/workers' protection, 40%, p less than 0.001. A surge in ethics literature during COVID-19 has advocated for permissibility of treatment refusal. Balancing healthcare provision with workforce protection is crucial in effectively responding to a global pandemic. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Arthritis and Rheumatology. Do existing MRI definitions of knee osteoarthritis identify knees that will develop clinically significant disease over up to 11 years of follow-up? Objectives. In individuals without radiographic knee osteoarthritis, KOA, we investigated whether MRI-defined KOA at baseline was associated with incident radiographic and symptomatic disease during up to 11 years of follow-up. Conclusions. Current MRI definitions of KOA do not adequately identify knees that will develop radiographic and symptomatic disease. Here are the articles from Journal of Clinical Rheumatology, Acute Kidney Injury in Systemic Sclerosis Beyond Scleroderma Renal Crisis, a Case Control Study. Background and Objectives. Renal involvement in systemic sclerosis remains a significant concern, with the focus often centered on scleroderma renal crisis, SRC. However, the broader spectrum of renal manifestations, beyond SRC, remains under-recognized. In our case control analysis, we describe other causes, risk factors, and renal outcomes of acute kidney injury, AKI, in systemic sclerosis other than SRC. Results. A total of 74 cases were identified. Out of these 74 cases, 27 had AKI, and 47 did not have AKI. Out of the 27 AKI cases, 4 with SRC were excluded. Advanced age, chronic kidney disease, and heart failure were identified as risk factors for AKI development. The predominant cause of AKI was prerenal etiology, accounting for 47.8%, N equals 11 of cases. This was followed by cardiorenal syndrome and acute tubular necrosis, accounting for 21.7% and 17.3% of the cases, respectively. Most of the cases with AKI had complete renal recovery, 78%, N equals 18, whereas 17%, N equals 4, had progression of the underlying chronic kidney disease. One patient progressed to end-stage renal disease requiring hemodialysis. Conclusions. This analysis highlights the risk factors and variable clinicopathological courses of renal involvement in patients with scleroderma. This may range from mild AKI with good prognosis to life-threatening SRC. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Loss of Y chromosome and cardiovascular events in chronic kidney disease. Background. Chronic kidney disease represents one of the strongest risk factors for cardiovascular diseases, and particularly for heart failure. Despite improved pharmaceutical treatments, mortality remains high. Recently, experimental studies demonstrated that mosaic loss of Y chromosome, LOY, associates with cardiac fibrosis in male mice. Since diffuse cardiac fibrosis is the common denominator for progression of all forms of heart failure, we determined the association of LOY on mortality and cardiovascular disease outcomes in patients with chronic kidney disease. Conclusions. LOY identifies male patients with chronic kidney disease at high risk for mortality and heart failure events. Here are the articles from journals of the American College of Cardiology. Prediction of cumulative exposure to atherogenic lipids during early adulthood. Background. The ability of a one-time measurement of non-high-density lipoprotein cholesterol, non-HDLC, or low-density lipoprotein cholesterol, LDLC, to predict the cumulative exposure to these lipids during early adulthood, age 18 to 40 years, and the associated atherosclerotic cardiovascular disease, ASCADE, risk after age 40 years, is not clear. Conclusions. Single measures of non-HDLC and LDLC, obtained between ages 18 and 30 years, are highly predictive of cumulative exposure before age 40 years, which in turn strongly predicts later life ASCADE events. From JAMA Cardiology, Emergency Medical Service Agency Practices, and Cardiac Arrest Survival. Question: which emergency medical services, EMS, agency practices, are associated with favorable neurological survival for out-of-hospital cardiac arrest, OHCA? Findings. This cohort study among 470 EMS agencies in the Cardiac Arrest Registry to Enhance Survival, CARES, for OCA identified 7 practices related to training, cardiopulmonary resuscitation, and transport that were associated with favorable neurological survival. Adoption of more than half, greater than or equal to 4, of these practices was more common at EMS agencies in the highest quartile of favorable neurological survival versus agencies in the lowest quartile, 59.3% versus 35.6% respectively. Meaning given wide variability in EMS agency rates for OCA survival, these findings provide initial insights into EMS practices associated with top-performing EMS agencies. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Vitamin D status, vitamin D receptor polymorphisms, and risk of type 2 diabetes, a prospective cohort study. Context. Vitamin D status has been associated with risk of type 2 diabetes, T2D, but evidence is scarce regarding whether such relation differs by glycemic status. Objective. To prospectively investigate the association between serum 25-hydroxyvitamin D, 25-OD, and risk of incident T2D across the glycemic spectrum and the modification effect of genetic variants in the vitamin D receptor, VDR. Conclusion. Higher serum 25-OD concentrations were associated with lower T2D risk across the glycemic spectrum below the threshold for diabetes, and the relations in prediabetes were modified by VDR polymorphisms. Improving the lipid profile, mainly triglycerides, accounted for part of the favorable associations. Here are the articles from Diabetes Care. Age of diabetes diagnosis and lifetime risk of dementia. The Atherosclerosis Risk in Communities, ARIC, study. Objective. The impact of age of diabetes diagnosis on dementia risk across the life course is poorly characterized. We estimated the lifetime risk of dementia by age of diabetes diagnosis. Conclusions. Preventing or delaying diabetes may be an important approach for reducing dementia risk throughout the life course. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Association between body composition patterns, cardiovascular disease, and risk of neurodegenerative disease in the UK Biobank. Background and objectives. Accumulating evidence connects diverse components of body composition, for example, fat, muscle, and bone, to neurodegenerative disease risk, yet their interplay remains underexplored. This study examines the associations between patterns of body composition and the risk of neurodegenerative diseases, exploring the mediating role of cardiovascular diseases, CVDs. Discussion. Our analyses demonstrated robust associations of body composition patterns, featured by central obesity, muscle strength, and arm-dominant fat distribution with both neurodegenerative diseases and brain aging, which were partially mediated by CVDs. These findings underscore the potential of improving body composition and early CVD management in mitigating risk of neurodegenerative diseases. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Effect of azithromycin on asthma remission in adults with persistent uncontrolled asthma. Background. Asthma remission is a potential treatment goal. Research question. Does adding azithromycin to standard therapy in patients with persistent uncontrolled asthma induce remission compared with placebo? Interpretation. In this study, adults with persistent symptomatic asthma achieved a higher remission rate when treated with azithromycin. Remission on treatment may be an achievable treatment target in moderate/severe asthma, and future studies should consider remission as an outcome measure. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Human neutrophils couple nitric oxide production and extracellular trap formation in allergic asthma. Rationale: nitric oxide, NO, is increased in the airways and serum of patients with allergic asthma, suggesting an important role in asthma. NO production has been widely attributed to the canonical inducible NO synthase. Much effort has been made to inhibit this enzyme, with two outcomes: NO asthma improvement and partial NO reduction, suggesting the involvement of an inducible NO synthase independent source. Conclusions. Our findings reveal a novel role of neutrophils as the unique allergen/EG dependent NO source in allergic asthma, enhancing ET formation. These results suggest that NO produced by neutrophils needs further consideration in the treatment of allergic asthma. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Validation of non-invasive detection of hyperkalemia by artificial intelligence, enhanced electrocardiography in high acuity settings. Key points. Measuring blood potassium has always required access to blood. The surface electrocardiogram, analyzed using an artificial intelligence algorithm, can detect hyperkalemia bloodlessly. The artificial intelligence analyzed electrocardiogram exhibited a high negative predictive value, but substantially lower positive predictive value. Here are the articles from Kidney International Reports. Virtual Nephron Evaluation of a Novel, Virtual Reality Educational Tool. Introduction. Recent technological advancements allowed the development of engaging technological tools. Using ASN funding from the ASN, we developed a 3D virtual reality (VR) physiology course entitled DL-Neph, Diuretic Action and Electrolyte Transport in the Nephron. We hereby present its evaluation. Conclusion. The DL-Neph VR platform appeared to improve short-term learning, but not long-term retention. Further studies are needed to investigate the impact of such teaching platforms on overall interest in nephrology.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.